My child was recently diagnosed with ADHD, and I know it explains why they struggle with sitting still and following directions. But I'm not sure how to handle their disruptive behavior. How do I address it without feeling like I'm being too hard on them? First off, let me just say I'm so proud of you for understanding where some of those disruptive behaviors come from. The sitting still and the focusing are definitely the symptoms that people know the most about when it comes to ADHD. But some of the other disruptive behaviors, and you didn't mention what those disruptive behaviors are, but other disruptive behaviors can also be a result of ADHD. Things like what in the clinical world we call a low frustration tolerance, which means that kids get pretty upset pretty quickly for seemingly very small things. That is a symptom of ADHD. Or losing things or having difficulty completing their homework, things that are really frustrating for parents. Things like not keeping their room clean or talking back or interrupting when they're being spoken to either by a teacher or by another adult. All of those things are actually symptoms of ADHD. But I want to tell you something, and I hope that you'll listen to this and understand what I'm really trying to say. Children with diagnoses, whether it be ADHD, whether it be depression, whether it be other things like even DMDD, disruptive mood dysregulation disorder, or PTSD, if a child has a diagnosis, that can explain their disruptive behaviors. But it does not excuse their disruptive behaviors. And in today's world, I've found that it's almost trendy to be looking for a diagnosis or to hope for a diagnosis or to be able to blame things on a diagnosis. But here's the thing, everybody's got something going on. There are very, very rare cases where someone comes into my office for a diagnosis and I can't diagnose them with anything. Everybody's got something going on, and everybody has to learn how to function appropriately in our world, even though they've got things going on. So just because your child has a diagnosis, it's great to be able to explain those behaviors, and it's great to have the name for the thing that's going on so that you can find the best supports for them. If there was no name for it, you'd just kind of be trying everything. But there are best supports for kids with ADHD or kids with any diagnosis. But just because they have a diagnosis doesn't mean that their disruptive behaviors should be excused. And it's not just like, oh, well, let's just blame the ADHD and my child doesn't have to ever take accountability for their actions. And unfortunately, that's what I see a lot. People will call me and they'll say, I can't believe that the school decided to have a punishment for my child. Don't they know they have ADHD or whatever their diagnosis is? And I have to explain, yeah, they might have ADHD or depression or PTSD or DMDD or autism even. That can explain those disruptive behaviors, but it doesn't mean that the child just gets to do whatever they want just because they have a diagnosis. Now, you asked a great question. How do I address it without feeling like I'm being too hard on them? So, now that we understand that diagnoses can explain a lot of disruptive behaviors, but they shouldn't be excused, now we need to talk about expectations. So we talked about explain, excuse. Now let's talk about expectations. 3X words, EX words, expectations. If there is an expectation of your child that your child cannot meet, then it's not appropriate to punish the child or have a consequence for the child for that behavior. But if it's an expectation that they can meet, or it's an expectation that they're going to have to meet, then it's not that they should just be excused from meeting that expectation. What we have to do as the caregivers and as the trusted adults in these children's lives is find ways to support them so that they can meet the expectation, or so that they can function appropriately without having lots of disruptive behaviors. And again, you can always come back and you can say, well, yes, this is because of the ADHD. So I do need to make sure that my consequences or my supports or even the punishment, I need to make sure that I take all of that into account, but it doesn't mean that the child just gets to do whatever they want. But first we have to ask, is this an expectation that they can meet? And if it is an expectation that they can meet and they're just choosing to use their diagnosis as an excuse, we have to let them know that that is not going to fly. That yes, you have ADHD. You're right. You do have ADHD. That doesn't mean that you're just going to get to do whatever you want. And that is a conversation. It doesn't have to be punitive right away, and it doesn't have to jump to extremes. It can just be, hey, yeah, you've got this thing going on, and yeah, it's going to be tough for you, but guess what? There's other kids in your class that have that, or there's other kids in your class that have other things or need supports in other ways. So I want to find the best way to support you. So how do you think we can work together to make this disruptive thing stop happening so much? And that in and of itself can be a consequence, is having this discussion. It doesn't have to be a punishment, and there don't even have to be big consequences. It can just be, how can we work together to overcome this thing? Keep all of that in mind, that diagnoses can explain behaviors. They do not excuse behaviors, but make sure that your expectations are rational and they are expectations that your child can meet. Then have a conversation with them about, hey, how can we work together, or what do you need to help this thing stop happening or happen less so that you can function appropriately in the ways that you need to. There's no specific answers. I know I didn't say like, oh, well, here's the thing you say, or here's the thing you do. It doesn't really work like that. There's not a one-size-fits-all approach when it comes to kids. So work with your child. You know your child well. Talk with them, collaborate with them, work with them, and help them figure out together how they can be supported to decrease those disruptive behaviors. Thanks so much for asking the question. Hopefully that answer was helpful. If it was, like this video. Make sure to like and subscribe, especially on YouTube. That helps me out a whole lot. It helps me go out into the world, into the algorithm. And yeah, I would really appreciate it if you'd like and subscribe this video.